Hi everyone, I hope you've all been well. I also hope you've enjoyed the masterclass interviews that I've set up for you. Now if you like these masterclasses, do provide us with some feedback and we'll try to do more of it. Now this week we'll be learning about critically appraising research studies using established appraisal tools, in particularly the CASP and the PEDRO. Now before we appraise some studies, we need to firstly understand how research questions are constructed. And not just constructed, but actually constructed well. For this, the most common framework is to use the PICO strategy. PICO stands for P, population, I, intervention, C, comparison group, and O, outcome. Many students and even researchers use this framework to construct their research questions more robustly. I've included a video that will introduce you to this PICO framework. Now going on to the critical appraisal tools. We'll be using the CASP RCT checklist and the PEDRO scale. These are two very commonly used critical appraisal tools. They're very similar, but have slightly different grading systems. CASP has a collection of different checklists for appraising different types of study designs. I provided you with a link on the module Blackboard site itself, so go and have a look at the different types of study designs. It might come in handy later on in the program and even going beyond into your own professional practice. PEDRO, although similar, is much more suited for randomized controlled trials or RCTs, so it is more limited in that sense. Now for the online session task this week, we'll be looking at a study by Susie and colleagues. The study looks at a psychological intervention and physical activity for depression. Now this is another interesting area in the clinical population where physiotherapists may have an impact on. So it's actually worth looking at looking closely at the study itself. At the end of the day, you should have learned skills in appraising a study using the tools we've looked at this week. You can then use these same skills to appraise other research studies. Now this is very important for clinical practice when we seek to find good quality research to inform our own clinical or professional practice. All studies, no matter who's done it, will have some sort of limitation due to the constraints or resources faced by the researchers. Another reason why some studies may have limitations is due to the nature of the interventions themselves. For example, some interventions simply won't allow you to blind the participants, but that doesn't mean that you can't blind either the researcher or the outcome measure assessor. So this will obviously possibly introduce some sort of performance bias into the entire study validity itself. So how is this week's learning relevant to your assessment? That is the annotated bibliographies. Well, the tools will help you to approach your critical appraisal studies in a more systematic manner. Now this will then allow you to select the most relevant criticisms and include that within your writing. So I hope you enjoy learning about appraising research studies this week, and I'll see all of you at the online session. Bye.